Right now, we want to talk about the cost of health insurance here at 921 because families across America are facing a critical time when it comes to affordability and their health care. Even as people are paying more each month, they're also getting hit with high copays, surprise medical bills in some cases, and even denied claims. So helping us to try to understand what's driving these costs is Wendell Potter, president of the Center for Health and Democracy, as well as a former senior health insurance executive. Wendell, appreciate your time this morning. Thank you for joining us.
Thank you, Jane. Glad to be with you.
Wendell, if you can help us understand the connection here between these major insurance companies reporting record revenues, profits, yet folks are paying more in their premiums.
These companies have gotten increasingly greedy. And they're under constant pressure from their shareholders. They're Wall Street companies, for the most part. They have to reward their shareholders with more and more profits. In 2024, just the seven largest health insurers made $71 billion in profits. They're not using that money to reduce our premiums or our out-of-pocket requirements. They're using it to enrich themselves and to reward their shareholders. So it's basically greed. And these companies have grown and grown and grown to be massive corporate conglomerates. United Health Group, for example, is the third largest company in America. Only Walmart and Amazon are bigger. But we're seeing that increasingly people are waking up to realize that these are the bad guys in healthcare. I see poll after poll, including one just this morning, showing that there is bipartisan agreement that health insurance companies need to be reined in and that they are the main culprit in ever increasing healthcare expenses and the cost of health insurance.
All right, so what does this mean for us everyday patients and what can we do about it?
What it means is that we are not getting the care that we need, even as these companies take more money out of our paychecks and out of our pockets. They've erected barriers like high out-of-pocket costs, refusing to pay for coverage our doctors say we need, limiting our access to doctors and hospitals. That's how we are paying a big price, even the financial price. $27,000 a year now for a family policy. We can't afford this. So I think more and more Americans are reaching out to their members of Congress. Congress is hearing from their constituents. That's why this week members of Congress are hauling in the executives of 5 big insurance companies. They'll be in the hot seat for 2 congressional hearings. So I think that we may begin to see some bipartisan help in attacking some of the problems that these companies have caused.
Yeah, the hearings tomorrow, January 22nd, that these folks will be taking the hot seat. What should lawmakers be asking them? And perhaps, when it comes to accountability measures, and then how to actually make a difference?
I would ask them, how can they justify making as much money as they do? The CEO of Cigna, where I worked, has made $100 million over the past 5 years. And that's the money that we know that he made and that they reported. But they've jacked up the price of premiums every year. They've gotten increasingly into other aspects of healthcare. Cigna, by the way, now makes far more money in the pharmacy supply chain. It owns a big pharmacy benefit manager. So Americans need to understand the structure of these companies, how they have been able to grow so big, how lawmakers and regulators have allowed this to happen, and it needs to be brought under control. And I would encourage people to pay more attention to these companies, reach out to their members of Congress, and demand that they hold these companies more accountable.
As someone who worked in the insurance industry, you changed your perspective. What made you decide to speak out?
I decided to speak out because even though I was paid really quite well, I was seeing the consequences of the actions of these companies, how they were denying coverage to people who needed it, how they were saddling people with high out-of-pocket costs that has resulted in 100 million of us having medical debt in this country. Most of those people have health insurance and are paying a lot in premiums, but still we have medical debt. And they're refusing to pay for coverage that people need. What really was the straw that brought the camel's back for me was Cigna's refusal to pay for a liver transplant for a 17-year-old girl. And she died as a consequence of Cigna's refusal to pay for something her doctors said they felt would save her life. I couldn't in good conscience keep doing that. That happens day in and day out. That was one notable example and the thing that led me to walk away. But that happens every single day. These companies refuse to pay for coverage for treatments and medications that doctors know their patients need.
I mean, it is so frustrating for so many families. And so when we hit that wall of frustration and trying to protect ourselves moving forward, I mean, what should we take away this morning? What can we do?
What we can do is pay more attention to our own experience. I'm seeing this groundswell of anger across the country at these companies. Demand that our lawmakers change our healthcare system, hold these companies more account, make some of their practices illegal. They're doing things that, in Charlotte, you have a big banking industry. Banks cannot do what big insurance companies are getting away with. So we need to change that.
All right, Wendell Potter, thank you so much. Appreciate the insight this morning. We'll definitely be keeping an eye out on those congressional hearings coming up this week.
Thank you, Jane.